Hi, everyone. My name is Joseph Leung, and I am one of the staff endocrinologists at Vancouver General Hospital. I'm also the research co-lead for the UBC PGME office, and I will be giving these lectures, podcasts on research in residency. So for this first session, we'll be talking about an introduction to research in residency. And the outline of this session is to discuss the benefits and challenges of getting involved in research as a resident, to dispel some common misconceptions about conducting research as a resident, and to provide some pearls for getting involved in research projects as a resident. So firstly, why should you get involved as a resident in research? Well, there are some benefits of it. So firstly, it allows for exploration of a particular field of interest, especially if you are thinking of subspecializing in a certain area or practicing in a certain niche area of your specialty. It provides opportunities to connect with other residents, fellows, staff that you may not otherwise interact with. It adds depth to your CV. So for example, for the purposes of a CARM subspecialty match, for example, if you're in internal medicine, pediatrics, for example, or maybe for your future job prospects. It enhances understanding of how research applies to clinical practice, contributes to evidence base and knowledge for medical practice. It helps to clarify whether research might be a part of your future career. And it can also inspire patient advocacy through your clinical work and research work coming together. Of course, there are some challenges of getting involved in research as a resident as well. So one of the big ones probably is that your focus of clinical residency training is on your clinical training. And so your clinical duties might limit the time that's available for research involvement. But there are also opportunities such as research blocks or other kinds of ways to get involved longitudinally. You might not be sure of who is a good mentor for research. So this is something that we can talk about as well. There might be a feeling of insufficient expertise for research. Maybe there are too many options and it's difficult to choose a project, or perhaps more likely, there's a lack of projects and not enough research mentors that are in your field of interest. There might not be enough resources for assisting you in your project. So for example, funding or statistical expertise, for example. And lastly, unclear benefits of getting involved in research. But I presume that's maybe why you are watching this video in the first place. So we're going to go through some of these common misconceptions of getting involved in research as a resident. The first one is that case reports are not worthwhile research endeavors. I would totally disagree with that. I think case reports are an excellent way of getting into research, and they really show your research interest, and they also kind of get your feet wet a little bit in terms of writing up a paper, getting it published, which can take a lot of time and perseverance as well. So this is a really good way of getting into research, is in diving right in and writing up a case report. So when you see an interesting case, ask your staff if that might be a worthwhile case to write up, and they can advise you either way. And if it is, perfect. You should get consent of the patient, and then you can touch base with your staff to see what's the best way to write this up in your field. Another option is if there's a particular staff whom you want to work with, or you really are interested in their specialty or subspecialty, you can ask them if they have any interesting cases for you to write up. So that's oftentimes a good way to get involved. Of course, in such a situation, you might not have that direct one-on-one firsthand experience with the patient, but nevertheless could be a way of getting you involved. So there's an example of an R1 who saw a very interesting case in endocrinology and wrote this up with an internal medicine staff. I was peripherally involved in this a little bit, and yeah, feel free to get fellows or other people involved in any case reports that you're writing up that could add to the depth of your paper. Secondly, I should aim to get involved in a clinical trial because of the strongest form of scientific evidence. So clinical trials are one form of scientific evidence. There are perhaps some stronger forms of evidence, like meta-analyses and systematic reviews, for example. There are also other study designs that I feel oftentimes in medical school and residency we don't learn enough about, but they are certainly really valid ways of discovering new knowledge, such as qualitative studies. Of course, there are also basic science studies, which can be difficult to conduct in residency, but I know others who have done it. I've done it myself, and I'll bring this up a little bit later on as well. Each study design has its own merits and would be most appropriate depending on the research question and scenario. So RCTs are obviously a really good way of researching and knowing something, but there are other methods as well that can contribute to valuable medical evidence. Number three, I must conduct a research project in its entirety, from conception of an idea to publication of the manuscript. Sometimes you might feel that if you didn't come up with the idea yourself, that it's of lesser value or lesser stature, but that is not true. As a clinical trainee, working on a project that a supervisor has thought through is a good place to start. So as an example, as a resident, I got involved in this project on PKU that was already started by another trainee many years previously, but never quite got to completion. And so I jumped right in, completed the processing of lab specimens in the lab during residency. A lot of the other clinical data had already been collected, so I just needed to do a little bit of additional analysis and then write up the paper. As you can see here, I got this first author manuscript published during residency. So it's certainly possible to do basic science in research, but of course does require some really good time management as well. But of course, there's a lot of other kinds of studies and clinical studies that could be done during residency that could be very valuable as well. If you're new to research, it can oftentimes be overwhelming to start right from scratch, and jumping on to an existing project is a good way of getting involved. And going hand in hand with that, number 4 here says being involved in research means I have sole ownership of a project. That's also not necessarily true. Research is becoming increasingly complex and collaborative as a result. So it's totally acceptable to continue a project that someone else has started, for example, or perhaps you can collaborate. If there's a question about authorship on an abstract or manuscript, this is something that should definitely be brought up with the study team. So this is a project that I did during residency as well, and eventually got this published, and I did it as a co-first author with another fellow at the time that was also working in this field. So that's oftentimes a really good way to jump into research, is to be doing it collaboratively with another resident, maybe even with a resident in another field. So this is a paper that I wrote with a pediatric endocrinology fellow while I was an adult endocrinology fellow, and that actually worked really well given the topic at hand. Number 5, abandoning a research project means that you have failed as a researcher. Of course, it's always nice to be able to follow through with the project and complete it, get something out of it, whether that is an abstract or a manuscript or both. But for various reasons, sometimes a project may not continue until the very end. Maybe you will run into some barriers to the research that we really can't get over. And that's okay. You will have learned something. And it's also really important to reflect on what you have learned. So with the advice from your supervisor, sometimes it might be best to abandon a project, but that also means that you have an opportunity to get involved in another project and really take the learnings from that project into whatever new project you might be involved in. So not completing a research project means that I have no hope of matching to your subspecialty of choice. Of course, a lot of people get into research to show their interest and enthusiasm for a particular specialty, subspecialty, maybe even job prospect in the future. But matching into your first choice specialty or job can depend on a number of different factors. Research involvement can demonstrate your interest and commitment, but completion of a project is not necessarily a major criteria for matching. Of course, it depends on the field. Of course, completing a project is also a great way to get involved as well. But sometimes research can be overwhelming or it may not be for everyone. So it's also okay to just understand that and realize that about yourself. On that note, there are some pearls for getting involved in research as well. So I'll be discussing these pearls over the next several slides. So the first pearl I have here is to look out for interesting cases that could be written up as a case report. If you've seen something on the wards, in clinic, in the emergency department, and you're like, this is such an interesting case. I wonder if I could write it up as a case report. There's not much literature on it, for example. Get a consent form, consent the patient or the family as soon as you think you might write it up. And if you end up not writing up, that's okay, right? But then if you don't get consent on an interesting case that you might think you might write up, then of course you're going to go back and get that consent later on. So it's best to just try to get that consent form right up front. There's an example here of a consent form for case reports from the BMJ, and you can just download these easily off the internet and get patients or families to consent. Some hospitals have photography departments that can also help with photos if you are wanting to include that in the manuscript. But of course, beware of how and where those photos are stored. Number two, contact researchers whom you're interested in working with. So you should ask around for supervisors who are interested in taking on residents, read some of the recent publications so you can get to know what they do, and perhaps ask them some questions if and when you first meet them. Contact them, be ready to discuss your thoughts about a potential project, and also know that some supervisors may want to see your CV. So this is one of the researchers at Children's Hospital that I reached out to when I was an internal medicine resident to see if she might have some projects that would be available and if she could mentor me. And sure enough, she became my research mentor, supervisor, all throughout my clinical and research training. And now she is my collaborator, and we do lots of projects together as well. So this is just one example of how you might get involved. Number three, you can work on a project that has already been started. That's oftentimes a really good way of getting involved. So when you do that, oftentimes a lot of the groundwork has already been laid. You can learn from that. And you might not be the one that is applying for ethics, or maybe you will be. There's different stages of projects that you can jump into. Some divisions or departments might have a list of research projects or research mentors available for clinical trainees to get involved in, to partner with. There's an example from our endocrinology division where we have a research compendium of faculty that are involved in research and perhaps some different possible projects that somebody could be involved in, and gives an example. So you can reach out to your division departments to see if there's something like that. Number four, it's oftentimes really helpful if you can to familiarize yourself with the ethics procedures at UBC. Case reports generally do not require ethics, although they do require patient consent. The RISE system on UBC now allows for a harmonized ethics approval with provincial health authorities. So it's becoming easier and easier to apply for and to get approval for research projects. If you're not sure about ethics requirements, do not hesitate to contact RISE. Their website is on the slide here. You can reach out to them by email, for example, and there are some guidance notes on the website as well about how you might obtain ethics approval for a project. Number five, ask for help when there's something that you're not sure of. So many supervisors with an academic affiliation have access to statistical support, for example, through the Hospital Research Institute. So this Center for Clinical Epidemiology and Evaluation is one of the resources at Vancouver General Hospital, for example, if you needed help with statistics. Sometimes the support may require a fee. So make sure you ask your supervisor about this, because sometimes they might have funding and they can share that with you for your project. Sometimes they may help you with some statistical support in kind, meaning that they provide that free of charge, or because you're a resident, they provide that as part of their services. Number 6 is to become aware of trainee-friendly venues for presenting your research. So many residency programs have an annual research day. For example, internal medicine, there's an annual resident research day. I know many of the larger residency programs have that as well. Additionally, many specialties have specific conferences with venues geared towards resident projects. So in endocrinology, in my field, the Canadian Society of Endocrine Metabolism is our national conference, and there's actually a specific call for abstracts called the Endocrine Resident Clinical Vignettes and Research Projects. So if you are a trainee, they deliberately want to encourage you to submit your projects. And oftentimes, the threshold for getting a project approved is quite low, accept almost everything. That's just a really, really good and easy way of getting something onto your CV, but also for an opportunity for you to present your research, to share with others, and have that practice in doing that as well. So look at the eligibility criteria, be aware of the abstract submission deadlines. And it's also a really good way to just network with others in your field when you attend these conferences and meetings. I think the last piece of advice here I'd give is to be persistent. Finding the right research opportunity can sometimes be difficult. You often have to ask several people in order to find a mentor who's willing to take you on. Conducting research can often lead to unforeseen challenges as well, and that might require you to change course, that might require you to learn something new, or seek help from somebody that you did not initially expect to, but that's all part of the research learning process. Resourcefulness and good problem solving are oftentimes part of the research process, and I think as part of your research education and residency education, this is just a really, really good way of absorbing that information and learning it, especially when you are right there, hands-on, working on these projects. There are some other resources. There is this book called the Research Guide, which is a primer for residents, other healthcare trainees, and practitioners, which is actually put out by the Royal College. And it goes through different kinds of research methods, why you might get involved in research, a lot of the similar things that we've talked about today already. And there's also some really good resources that it shares in case there are specific topics that you want to learn more about. So in summary, research during residency training can take on many different forms. Involvement in research does not need to be a large study, an experimental trial, or some kind of an RCT. Even a case report is a really great way of getting started. Perhaps a smaller study, a cohort study, a retrospective chart review. These are all really good examples of doable, realistic research projects in residency. Finding a good research supervisor who can mentor you through the process is important. Be persistent. And lastly, research during residency training can be exciting, rewarding, and educational as well. So thanks for listening to this podcast, and hope to see you in the next one.